And now I have the honor to give the floor to His Excellency Mr. Joseph Vorake Bainimarama, Prime Minister of the Republic of Fiji. You have the floor, Your Excellency.
Thank you, Excellencies, ladies and gentlemen. Fiji has set a priority on providing unfettered access to high-quality health care for all Fijians, with special efforts underway to reach our society's most vulnerable, our women, our children, the elderly, and the disadvantaged. I believe this is the value we all share, and I want to thank the governments of Thailand and Georgia for ably shepherding this discussion through the United Nations as our co-facilitators. Fiji's citizenry is dispersed over 120 populated islands, so achieving universal access to primary health care demands that we blaze an uncharted path, led by solutions tailored to our unique set of challenges. We share these challenges with other small island developing states that are too small to bring the advantages of scale to the healthcare system. Nevertheless, Fiji is using strategic investment to build a healthcare system in which access to quality care is unbound by geography, background, or socio-economic status. Our progress is paying dividends, both in realizing the constitutional right to health for every Fijian and in advancing the 2030 Agenda for sustainable development. We are vastly improving the quality and accessibility in preventive, curative, and specialized care. Our national health system is free to all Fijians, and tens of thousands of disadvantaged Fijians benefit from our free medicine scheme. Our health professionals now enjoy much improved working terms and conditions and can now access an unprecedented range of postgraduate training and professional development opportunities. Through our decentralized healthcare system, we have placed health workers and infrastructure directly in remote communities, many of which are located on distant islands. Our subsidy of overseas travel has put life-saving care within reach for low-income families. And we recently launched a public-private partnership to bring international expertise to the management of 2 of our hospitals. That alone is bringing a suite of new technologies, training opportunities, and health services, including full tertiary care. But these accomplishments, Your Excellencies, extraordinary as they may be, are all placed at grave risk by the wide-reaching devastation of climate change. The fact is that climate change has increased health insecurity worldwide, and we now need to climate-proof our health systems in every way possible. The historic advancement of the Fijian health sector can only be protected and sustained through collaboration with our partners from around the world. Only together can we develop health infrastructure that is resilient to the many possible blows that a changing climate can inflict on us. Only together can we identify, educate, and train the people we need to deliver this care. Only together can we attack the root cause of this crisis and adapt vulnerable communities, economies, and healthcare systems to the climate realities that we all know we face. Thank you.
You have another booth over there?
Genuine universal health care can only be properly realized if we continue to cooperate and